Thanks, Lauren, and welcome everyone. We really appreciate your time and attention this afternoon. We know that Friday afternoons are hard. Lauren and I have had the chance to actually observe some remote lessons this week, and we just can see firsthand the effort that it is going into all forms of instruction across the state right now. And we really appreciate everything that you are doing to make that happen. And so just we hope that getting some more information today about our BinaxNOW rapid point of care testing will just it further advance us in providing very high quality instruction for students. Because again, the more that we know about, in this instance, the spread of the virus in our schools, the more confident we can be about providing in-person learning. And we really appreciate your willingness to do so. Since we first announced that phase 1 was underway, many more schools and districts asked to join us. And so today we have involved in this project right now 159 schools and districts on the public school side and 84 private schools. And so really all of you, welcome today. Thanks for your interest. For today's purposes, we have actually a fair amount to cover, and I'm going to try to use my very calm Russell in the evening voice just as we walk through this and kind of learn what we need to know about these next steps related to consent and reporting. And we'll certainly save time at the end for questions. And as always, you can email Lauren and me with any questions that you have. We'll be glad to help you out as we get through this process. So again, our focus today is on consent and reporting, but we'll also take a little bit of time to talk about training. I'm so pleased that we're joined by our colleagues from DPH, Jill Clark and Karen Robitaille, who will just be on hand if we have any questions about training, and we'll tell you more as we go along. So first of all, though, we're excited about the completion of the clinical study that happened at Lawrence General Hospital. And we're joined by Sandra Smolay, Dr. Sandra Smolay from DPH, who is the State Clinical Lab Director. So Sandra, I'm going to turn it over to you. Hopefully you can unmute yourself and just tell me, this is just one slide actually. So I'll advance the slide and maybe you could just tell the group about the results of the initial results from the clinical study.
Very, very happy to do that. Thank you so much for the invite. As many of you may have heard, DPH led a study at the Lawrence General Hospital's Community Stop the Spread site, and where we were very interested in assessing the performance of the Abbott BinaxNOW rapid point of care test. And we compared that test to the gold standard PCR. What we found was that of 1,664 participants, folks that came through this testing site, of which there were 233 which were individuals less than 18 age. And this is very important because there to date has not been data showing how this test performs in children. So what we found was that the findings from this study conclude that the BinaxNOW test has very high specificity in both adults and children, and has very high sensitivity in newly symptomatic adults. The sensitivity across the test, sensitivity of this test across both adults and children was also found to be 98% among those with the highest viral load. So that's very important and very reassuring to all of us about the utility of this particular rapid point of care test. Russell, I think that's all I have for today, and I'm happy to be present and listen to the rest of the discussion today.
Thank you, Dr. Smolay. I think that we wanted people to know firsthand about the results of the study, particularly because there's a lot of information out there about antigen tests, and we wanted you to have the facts as they've come out of the study. I know that I've just been so reassured whenever I've had a chance to talk with our colleagues at DPH about this study that they, overall feel just really enthusiastic about the results, very positive, very that these results support our plans for the use of this test. They don't in any way diminish our plans, and in fact, maybe allow us to continue to consider, how this test can be used to support in-person learning. So, appreciate you being here, and if there are any questions, we'll be glad to take them at the end.
Thank you.
So let's talk about.
Thank you. Is the test available? Is the study available for review?
We will be putting out a rapid preprint very, very soon. So we're working very diligently on that. So almost.
And if people wouldn't mind just putting questions in the chat, appreciate the question, but we'll just make sure that we save time at the end for questions as well. We have information about the pre-authorization and pre-registration that needs to happen in order to have the information available about consent and reporting that we think is a crucial component of this. We think about the test, but there's really so much that goes on around the test to make it work. And so I really want to start by just kind of explaining kind of two worlds and two scenarios for you. One is the scenario that we chose not to go with, which would be where for every time that you were to sign a child up or a staff member up for providing this test, you would have to have a paper-based consent form signed by either the individual taking the test if they're age of majority, or by the parent of a child who's not of age of majority. That paper form would have to come into the school, be collected, let's just say by a school nurse. That information would have to be manually inputted into some sort of database. The student would be tested, or the staff member would be tested. The results would have to be entered at the school level manually, and then all of the results would have to be reported to DPH in a manual way. And so that's just a lot of effort. And we felt like there has to be some way to cut down that effort, because we know that that could be a hurdle, that could be a hindrance to the effectiveness of administering this test. That if there's so much manual data entry that has to go along with this, it might take away from schools and districts that want to actually use BinaxNOW. So I really appreciate that our colleagues at the Executive Office of Health and Human Services, as well as our colleagues at DPH, have teamed up to be able to support our involvement of a partner organization called Project Beacon, and we have representatives from Project Beacon with us here today. Towards the last third of this presentation, we'll certainly introduce them, and you'll have a chance to get to know them a little bit better. But this is really important. This is what I want you to know. What Project Beacon is able to do is to have what will be available for you is a web-based consent process that will also be app-based. And Jeremiah, feel free to jump in at any point if I'm off base here. I'm joined by my colleague Jeremiah Hay from the Executive Office of Health and Human Services. But what we want for you is a way in which as much information can actually be preloaded into Project Beacon as possible, so that we don't have that manual entry on the front end, that parents can use the app or the web-based service to provide their consent, that they don't have to be sending paper forms into the school or district, and that after the test results come in, after the result is known, that is the part where whoever is administering the test, whatever health professional is administering the test, that information has to be entered into this same online environment, this same online platform. And so hopefully we get to a point where the very minimal data entry that has to go into this at the school level, as much as possible, is just the results of the test. And then what I think is pretty amazing about what Project Beacon is building for us is that then those results are immediately communicated, really importantly, to the parent, right? We want our parents to know the results of the tests when their children get tested in school, but also to DPH. And then they're also kept within, like a school administrator can also look at the results. And I think that really cuts down on the effort. Can you imagine, again, having worked very closely with school nurses in my career, I'm imagining, again, a scenario where a nurse is having to call parents, having to upload data into the DPH system. We also need positive results reported to DESE, which still has to be done. And then also the school administrator, the district administrator, who says, well, what are the results? Who can show me sort of a dashboard of what's actually happening as a result of these tests? And without a platform like what Project Beacon has developed for us, the labor that would be involved, I think, would be pretty astronomical. And so what Project Beacon brings to us is a very integrated, streamlined, customized tool for us to use. And I know that, Jeremiah,
sorry,
please.
Russell, can I just jump in very briefly? And hi, everybody. Just want to make sure we're setting expectations. So the Project Beacon system works in a couple of different ways. We're going to talk about it. They're going to talk about it during this hour. But the notifications will happen sometimes. We're going to try to get them, as much as we can, but it's not going to be in every single case. It's going to notify the parent based on how they get into the system. And I do think, Russell, what you've said about how much simpler this is than reporting every single result manually to DPH is right on point. And I know also that the BinaxNOW kits and Abbott have an app that's kind of built in as part of their service called the Navica app. You might have seen that. That app does not, unfortunately, report these results to the Department of Public Health. They all have to go there. So that is why that we have gone down this road. And I am very confident, having worked with Russell and also with Project Beacon, that this is going to be a good process that's much easier for schools than the alternative. And so you all are in good hands.
Thanks, Jeremiah. Thanks very much. Really appreciate that. And feel free to continue to jump in like that. We all want to make sure we're providing the most accurate information possible. So thank you. So at the end of the day, what will happen in short order is that you will be asked to have one person from your district complete an account registration form in order to kind of begin that process of being signed up with Project Beacon at the school or district level. And that one registration form will sort of kick off the process for your organization of being part of the Project Beacon system. So with that in mind, that gives you sort of the background of what we're building here to support consent and reporting. I'd like to talk a little bit about the types of consent. And this is important. There's some details here that I'd appreciate if, as you pay close attention to them, you're going to have to determine what the scenario is for your school or district related to consent, because we know how important it is. And there are two types of consent that we have to think about. The first is just the consent for there to be disclosure of information to the Department of Public Health through Project Beacon. So we need our families in this instance to allow and give that consent for information about their children in particular to go to DPH through Project Beacon. And those of us working in schools, we know that this is an important, we always have to get consent before we're going to release any student level information to a third party like Project Beacon and even to another state agency like DPH. Or if we're going to do it through a third party, I guess I should say. But then there's also the need for consent for testing and reporting those results to DPH. So when we say consent, we mean two types of consent: the sharing of student data level of consent, and then also the consent for testing. So let's talk first about the consent to disclose information to DPH through Project Beacon. There is sort of an important determination that you're going to have to make about which pathway will be the right one for you, given your own local policies. So let's just look at what those pathways might be and how you're going to figure that out for yourselves. So some of you in this meeting, maybe not all of you, are familiar with this idea of directory information. So directory information is, as defined by FERPA, are information about the student's name, address, gender, just basic demographic information. It also includes things like what programs students are involved in, if they've received honors or awards. Those are all considered to be part of directory information. Some districts have the ability to, based on their policies, and when I say districts, allow me to just use that as shorthand for schools and districts. So some districts have a policy where directory information does include contact information. And there are some districts who have a policy that prohibits the use of contact information to be shared publicly through directory information. So let me just share with you kind of two examples. We just got these off the web. They're publicly available. They were easy to find. We're going to give you a contrast between Brookline Public Schools and Boston Public Schools. There's no right or wrong here. It's just this is sort of asking, what's the available pathway for you? So if you kind of look closely at this slide, you can see in the middle here that they have a policy that talks about directory information. It cites FERPA, and it says that the district, in this case Brookline, has the ability to release certain information about students without parental consent, and provided that annual notification has been given and the school does not have on file an opt-out from the family. That opt-out is important. And it talks about what information could be shared. So if this is the scenario for you, if this is the pathway that you're on, it means that it's pretty easy actually to upload, to take the information out of your student information system and share it with Project Beacon. And they automatically have information about all of the students who might be tested. And that way it really kind of cuts down again on that manual entry. So this is the Brookline example. You might though be in the Boston example, where Boston Public Schools very specifically does not include contact information in the definition of directory information. So again, they state that even though it's allowable under FERPA, Boston is choosing not to release information about contact information about students. And so those two scenarios set up kind of two different pathways that you might be on in terms of your interface with Project Beacon. So let's just look a little bit more closely at these two pathways. So again, this is the Brookline pathway where the directory information includes contact information. So in this instance, where you've notified the parents annually, like we saw with Brookline, the district would be able to import student contact information into Project Beacon, and the users would then receive an email or a text message, depending on what data you put in, asking them to create the rest of their account. So this is just sort of the beginning phase, and there would be some more information that parents would be asked to add to that. Just so again, it's a short process, maybe 2 to 3 minutes, but it will really help with the administration and reporting of results because of the additional information that parents will add. If you are more like Boston Public Schools and your directory information does not include contact information, there are kind of two options for you. And the first one is the one that's available right now, and the second one is coming a little bit later. So the first one would require written consent and manual upload. So we will have available for you, and I'm not checking the chat right now. Jeremiah, is it going? Is Lauren able to put that into the chat right now? The consent.
I don't believe it's in the chat right now, but it will certainly be in the chat by the end of the webinar.
I will add it to the chat momentarily.
Thanks, Lauren. Thanks very much. So we will have the written consent form. Lauren, do you mind? It's all one consent form, right?
So what I'll put in the chat is the full memo, which overviews all of this information. And then in the appendices, you have the consent forms. But yes, Russell, it's the full consent form. It's both what's written here, the consent to share the contact information, and also the consent to test and report information to DPH.
Thanks, Lauren. Thanks very much. Thanks, Jeremiah. So if again, if you are on this pathway, you will need to seek out that written consent and then manually upload that information into Project Beacon using their web-based platform. And then in short order, very soon, we will have a self-registration process where you would be able to share a link, and Jeremiah, step in here at any point if I start to go astray. But you would be able to share a link with families so that they can actually self-register and that someone on your staff doesn't have to do this manual upload. Jeremiah, anything you'd want to correct there?
It might end up being a code instead of a link, but that's correct. Thanks, Russell.
Great. Thanks very much. So I hope that helps to get you thinking about which path you're on and to figure that out. I think it's also important to mention the families, if you are on path one, like Brookline, where you have the ability to share directory information to Project Beacon by importing information, there are some families who may have opted out. And so I would just put a footnote on that to say, even if you're on pathway one, you might have to use some aspects of pathway two in order to support those families who have opted out of the sharing of directory information. So now let's turn our attention to the second type of consent, which is for testing and reporting results to DPH. So we have to make sure that we have consent, obviously, before we administer the test. And people who will, parents who will be consenting for their children, or either students of the age of majority or who can sign for themselves or for staff members, they'll have to agree to all the terms in order to be tested. Again, it's not surprising. We're kind of used to that sort of thing with every app that we download on our phone. We just have to accept the terms and conditions in order to avail ourselves of this service. And there are 3 ways that we can obtain consent. There'll be a web-based option, a paper-based option, and then an emergency day of verbal consent. So we'd like to just talk to you about all 3 versions. And just starting with the web-based consent. So in this option, once individuals have that profile on Project Beacon, they will actually be able to consent to testing through Project Beacon. There'll be no consent form that has to be filled out. As Lauren uploads the guidance information that really tracks to this PowerPoint. So if you're feeling a little whelmed, I won't say overwhelmed, but if you're feeling a little whelmed by this presentation, go back, you can listen to the recording again, you'll have our PowerPoint, but you can also read the guidance materials that Lauren will put into the chat, and they'll walk you through this same order, same information that I'm sharing right now. And at the end of it, you'll see the consent forms like Lauren mentioned a minute ago. And what Project Beacon will have in their online portal will match the same information that's on the consent form that's paper-based, that's included as an appendix to the guidance materials that we will share with you this afternoon. So you can imagine that, you know, we're kind of used to a medical authorization consent form. That'll be that sort of thing that parents will be able to authorize for their children or staff for themselves. And then Project Beacon does its notification process once that's completed. If there has to be paper-based consent, then you know, if parents, if individuals lack internet access or can't interface with Project Beacon, you can still use a paper-based format. And we are putting the sample consent forms in our family communication toolkit. And that link is included in this PowerPoint for you, so you can click on it. And Lauren, those consent forms are in the process of being translated as well.
Correct. We have the consent forms now in the Family Communications Toolkit, which I just put into the chat. We are in the process of translating them, and there's a series of letters also in there to accompany these materials.
Thanks, Lauren. Do you want to say just one more word about the letters before we go on?
Sure, we've created 2 sets of letters. One letter that is directed towards families to notify them of the BinaxNOW antigen testing opportunity and to give them information about what it is, and then to let them know that they will be asked to consent to the test, in which you can then attach the paper consent forms, or you can go the route of having uploading the roster and having Project Beacon email them, depending on the director information piece. And then we also have a sample letter that was created once the test is completed to notify families of what the test result is. So it gives them the information of that the test occurred, what the result was, and then what they should do in the instance of a positive test and a negative test.
And Lauren, we're having those letters translated as well.
Yes. They are, some of them, one set of the letters has already been translated and is in the Family Communications Toolkit, and the other set of letters will be translated this afternoon. But all of the English versions are in that folder in the toolkit for you to access now.
Great, thanks, Lauren. So again, this is going back to the options for consent, and if you have to use a paper-based consent in some instances, we hope that it's a more limited set of instances. You know where you can find them using the Family Communications Toolkit. And then you can kind of imagine that once that consent comes in, then the administering professional who is administering the test would then manually implement that information so that the results still go in, everything still goes into Project Beacon, even if it's done through this process, because this is how it will, in a streamlined way, get the information to DPH. And that way, the professionals who are doing this work at your school or district level won't have to guess how to get this information to DPH. It always goes through Project Beacon. And then finally, we imagine that there could be some scenarios where you want to make sure that you are able to test kind of an emergency basis day of, but you don't have consent through Project Beacon or paper-based consent. And so if you're not able to acquire that advanced consent, then there could be a scenario where the professional from your school is receiving verbal consent over the phone prior to the test administration. And you still would have to follow up with the request for written consent immediately afterwards. Lauren, would you mind just saying a little bit more about any other details about this emergency day of verbal consent?
I don't think I have anything additional to add other than the only type of verbal consent that you can get is to actually take the test. You can only consent verbally to take the test. You cannot consent per FERPA to share contact information. And so you'll just have to look individually at your students and whether or not they allow their contact information to be shared. Again, looking back at that directory information and paying close attention to the memo that I just put into the chat of whether or not you can actually use contact information for the system.
And I think it's important to remember that this emergency day of consent, it's really optional. You don't, if it doesn't feel right, you don't have to use it. So we just want to make sure that you're aware though of all of the scenarios. And we really hope that it's option 1 that will be your default, maybe a little bit of option 2, and hopefully very little of option 3. But we wanted to make sure you know about it. So then thinking about the recording results in Project Beacon and reporting to DESE. So the administering professional will need to update Project Beacon with the test lot number and the test results. So remember how I said what we're trying to do is cut down on that manual entry to get the student information into Project Beacon. But there will have to be some manual entry around the test results. So the two things that whoever is administering the test, that administering professional, will need to include the test lot number and the test result. And so then they'll receive information about when the test has begun and when the results are ready. So anybody with a user profile will get that information. And then the results would need to be shared with families. And like Lauren said, oh, thanks, Lauren. I appreciate that you had actually already queued this up around the letters. So just a reminder about the ways in which you can talk to families about the results using the letters that we have in our family communications toolkit. And then finally, as I think many of you are very used to, the one additional step that you'll need to take is to contact our help center, and the phone number is listed there for any time you have a positive result, including a result through BinaxNOW. Keep in mind that all of the results go into Project Beacon. DPH needs to know about both positive and negative results. DESE, we only need to know about the positive results. So I hope that's helpful. So as we kind of wind down this section and in a minute turn it over to our colleagues and our partners from Project Beacon, I would just like to say a word about training. And I'm again really pleased that we're joined by Jill Clark and Karen Robital from DPH. And just some information that you should know is that we appreciate the training materials that came with the test. And we've shared those links with you to the resources that Abbott Labs has made available. But we also know that health professionals, including school nurses, should have some additional training before they administer the test. And in particular, we want to make sure that there is a way in which they are able to have kind of live interactive training. And so that's what Karen and Jill are setting up. And again, really appreciate their work on that. Their first training will be next Friday. There'll be a little bit more information forthcoming soon about how to register for that first training. It will be a train the trainer model. And so meaning that if you're a larger district or a larger school, you could have one health professional attend the training and then they could train other people from within your setting. So that's good news. That means that not everybody who's administering the test has to attend this particular training. This training will help to spread the word effectively, spread the knowledge effectively from within your setting. But because it's interactive, registration will be limited. And so we look forward to getting people started with that first training next week. Then more trainings will come. We know that more will be necessary, and really appreciate that our colleagues at DPH are working to set up more of those trainings. What's really important to know is that you have to have testing kits on hand in order to do this training. And so we'll say a little bit more about at the end about next steps and getting those testing kits. We're ready to ship. Next Tuesday will be the first shipment date for the tests. And so if you wanted to be included in that first training next Friday, we'd want to make sure that we're shipping tests to you on Tuesday so that you have them in time for the training on Friday. And that after that, then you are ready to move forward with administration. So again, we'll be glad to answer any questions about that at the end. But Karen and Jill, did I miss anything there that I should emphasize or that you'd like to emphasize at this time?
One quick note from me, actually, Russell. So this is something that we would encourage people, including school nurses, to do if they feel like they need it. And you do need the test. But this is not something that you're strictly required to do if the administering professional, after reviewing the trainings that Abbott has online, feels comfortable administering the test.
Thanks, Jeremiah. I think that's a good point. There are certain health professional jobs require a certain level of training before they take certain actions like this. And so this is available for health professionals who need this type of training to administer this type of test. But we had talked about before that health professionals can include a wide variety of professions. And Karen and Jill, feel free to chime in here any further, but this could include obviously school nurses, but also certified nursing assistants. It could include EMTs who could be available. We really appreciate the ways in which fire departments have stepped in to help public schools and private schools during this time. So just wondering if Jill and Karen, is there anything more that you'd want to emphasize here?
You know what, I'm sorry, maybe I need to unmute them. Can we just make sure that they can talk if they want to?
Great, thank you. That was
sorry about that.
Sorry,
that was a little frustrating. Yes, we are recommending that nurses do partake of this training, and we'll be able to actually walk you through administering the test and doing actual swabbing with a nurse from the state lab. And that first training will just be the first. So just know that there will be many more to come leading up to the Christmas break and then again in January. And I'm really asking that only the nurse leader or a trainer from each district attend and then train the rest of their staff so that we can keep the classes small so that we're able to really give you that interactive skills-based learning that we know that nurses need.
Fantastic. Thanks, Karen. And again, we'll be glad to see if there are more questions about training at the end. But right now, I'm going to stop sharing my screen so that we can now move over to our colleagues from Project Beacon. We have both Brett and Jackson with us. And so Brett and Jackson, if you just want to start with introductions as our school and district leaders get to know you and hear more about the service that you will have available for us.
Yeah, absolutely. Good afternoon, everyone. Thanks for taking the time. We really appreciate everybody's thoughtful attention to this, and thanks to our partners at DESI and EOHHS for pulling this together. I'm Jackson Wilkinson. I'm the Chief Technology Officer at Project Beacon, and I'll talk a little bit more about us in a moment. I'm also joined by Brett Cook, who serves as our Chief of Staff. I'm not sure, Jeremiah, if he's on the unmute list, but
thanks. I will make sure he is.
It'll be great to dig into this and tell you a little bit about what we've been working on over the course of the last few months, and especially over the course of the last few weeks as we've been working with the state on this particular use case. So just briefly, a little bit about us. We're a social benefit organization with no profit motive, dedicated to, as it says here, increasing the capacity, accessibility, and affordability of testing here in Massachusetts and increasingly beyond. We were founded by 3 organizations that you might be familiar with: the Broad Institute of Harvard and MIT, which is a major genetics lab that does extensive amounts of testing, not just in Massachusetts, but across New England. F Prime Capital, which is the venture capital arm of Fidelity, and GV, the venture capital arm of Google. And specifically at this point, We offer end-to-end testing solutions from registration to scheduling. I'll talk more about the capabilities of our platform. It's important to note that we do prioritize the needs of Massachusetts and its residents. And we, when working with employers for employee testing programs, we charge the private sector more so that we're better able to serve the public sector and underserved use cases. And of course, it's very important for us as an organization to share learnings with the public and ensure that anything that we have learned is available for others so that we can accelerate our progress in dealing with this pandemic. But most important to this conversation is that schools are incredibly important to us. We are parents, my kids in the red shirt. These are other kids from across our team. And hopefully my kid's he's in hybrid in Massachusetts public schools, and hopefully he's being picked up right about now. Normally that would be on my watch. So hopefully that's working out okay. But it's just as important for us that programs like this be successful as it is for all of you. And so we're really putting everything that we can into helping make this type of effort a success. So we serve 5 use cases, and I won't belabor these points, but K-12 schools is an obvious use case that we're talking about today. But we also help employers with employee testing programs, public test sites, which we'll talk about in a moment, vulnerable populations like assisted living facilities, and colleges and universities who need to test students. And you may be familiar, probably the opportunity to be most familiar with us is through the express COVID-19 testing sites that we've been setting up here in Massachusetts, which we have one open in Revere that we've run over 25,000 tests at. We test over 1,000 people every day. And the most noteworthy thing about public testing sites that are powered by Project Beacon is that they're incredibly fast and efficient. And that leverages one of the key things that Russell pointed out, which is we collect the information required for testing in advance. We make sure that it's accurate so that you need to spend 0 time on site filling out forms or doing paperwork. And so, you can see here an example of our median time to completion from check-in to check-out, 3 minutes, 42 seconds across all of our tests over the course of the last couple months. And in yesterday's test, we were under 3 minutes across the board. So we do our best to make everything as efficient and painless as possible, whether it's a public test site, whether it's employee testing, or in this case, for point of care testing. As I mentioned, sometimes testing sites are huge, like the one in Revere. Other times they're very small, single person with a laptop for an employer or a school. And they can be RT-PCR tests or, as in this case, point of care testing, including the BinaxNOW assay. So all of this is really enabled by the Project Beacon platform, which is a software platform that we've built that intends to cover the end-to-end process of a testing program, from personnel and program management, which is sort of creating and maintaining the rosters of, in your case, the students and staff at your schools, registration and consent, which we've talked plenty about so far, conducting tests and capturing those results and making sure that all the required steps and information are collected, and sharing results with the appropriate parties, whether those are parents and guardians, the participants themselves, or public health authorities like Department of Public Health. So as Russell mentioned, the getting started is pretty straightforward in this sense. The account registration form that Desi is sharing out is the first step there, and our team will take in those registration forms, prepare accounts for you, and you'll receive a message from Project Beacon when your account's been created. And so I want to walk through the platform very, very briefly. We're going to have future webinars to cover this in more detail, but really just give a sense of what the steps are involved here in using the Project Beacon platform. And step 1 is to create and upload your roster. So this is a roster of everyone that you intend to be part of the testing program, students, staff, etc. It can be in one file or it can be in multiple files, that's fine. But uploading a CSV file, which you can edit in Excel, will prompt us to send an invite to those individuals to register for a Project Beacon account associated with your school. The next step is to collect consent and demographics from participants. And for those who did take the step to register online and accept that invitation, we'll be able to collect that electronically, automatically, and pretty painlessly. And for those who don't, Russell mentioned a couple of options that that you will have to collect that manual consent and then log it within the Project Beacon system so that we know that those individuals are eligible to be tested. And then third is the actual work of administering the tests. So anybody who has gone through that process of consenting and completing a profile is eligible to be tested. And it takes just a few clicks to do it. We don't want to get in the way. We don't want a burdensome process here. And so effectively you're checking a patient in, you're logging that their sample's been collected. We count down the 15-minute timer associated with BinaxNOW, and then you record the result, positive, negative, or invalid. And the best part, as soon as you record that result, we not only notify the account holder, which could be a parent, could be the staff member themselves, that the result has been logged in the system so that they can go in and see it, but we also notify DPH and handle those reporting responsibilities. As mentioned in the last presentation, you'll still need to notify DESI of positive cases. So I just want to get a little bit more in depth on the consenting process because I know that's something that that everybody is thinking a lot about. And there are sort of two main pathways here. Pathway A is for individuals who did accept that invitation that we sent via email or text and self-registered online after being invited. And once those folks from your roster have accepted that invitation, one of the very first things that they do is consent and add the demographic details that are required for being tested. And so this is a quick look at it. The consent form is on there and the parent or the individual being tested would agree to those terms. For individuals who did not accept that invitation and consent online, there are a couple of options. And the first being paper-based consent. Those consent forms were shared in the chat. And as you heard from Lauren, will be translated shortly for you to use to reach out to individuals who either because of FERPA reasons or because they weren't able to access the platform for whatever reason, need to use a paper-based consent process. Once you've collected that information from the individual or their parent or guardian, we have an interface that would allow you to input that data and then manually mark and log that consent had been received. And we collect the timestamp associated with that and log that appropriately. And this process, if it's appropriate to you, as Russell said, and feels appropriate for your organization, your school, can use that same process for the emergency day of verbal consent process. But effectively, this one workaround process will allow folks who didn't register online to be tested. But it's important to note that folks who use this route will not receive text or email notifications from Project Beacon. We won't have the contact information associated that we need in order to send those notifications. So with that, I'm really wrapping up here. We'll have more webinars that get it and double click into more detail on things like uploading rosters and managing personnel, administering and reporting tests and getting consent, as well as other topics that come up with lots of room for questions and answers. And we're putting documentation up on our help website, which is at help.beacontesting.com. And of course, now or later, we're happy to help and answer any questions along the way. So with that, I will toss it back to Russell and the folks at DESI.
Thanks, Jackson. So I'll just go back to sharing my screen real quick. Go to presentation mode. As if you all need to hear my voiceover. There we go. All right. So a couple of next steps just to review with you quickly. It's important to know that now that you have this information today, we ask that you continue to work on meeting the preconditions, and we appreciate all the work that's gone into that so far. One of the preconditions is around consent, and the information that you have today now satisfies that precondition. You don't affirmatively have to have every parent's consent in order to move ahead, in order for you to submit your readiness checklist to us. And Lauren, please correct me if I'm wrong, but we actually would ask that you start to submit your readiness checklist sooner rather than later. Because like I said, if you are having school nurses trained, you have to have the kits on hand. And so you can't get the kits until you submit your readiness checklist to us. So we would ask that you, if you've met all of the preconditions, now you have as of this webinar today, and the information that we're putting in the document that Lauren is putting in the chat, you have what you need to meet that precondition. And if all the other preconditions are met, we would encourage you to move ahead with submitting your readiness checklist. And so for our phase 1 participants, please email Kristen Kastner, and this is Kristen's email address. And then for phase 1A participants, those are our private schools, please email Lauren Wu. And then another really important next step, as I mentioned earlier, is just determining the status of your directory information. Which pathway are you on, and what actions do you need to take as a result? And then finally, when we provide you with that information about registering for the Project Beacon account, we would ask you to go ahead and register for it so that you begin the process of getting connected to all of the services that Project Beacon provides. So let's go to your questions, and I will just quickly call them up from the chat. And I think I've unmuted everyone. I'm just going to go to a slide real quick. This was requested in the chat. I think I've now successfully given co-hosting responsibilities to, I think, everyone who needs to be unmuted. And I do apologize, Karen, for not seeing that earlier, that you were muted. So thanks for bearing with me. Karen, let's start with you with some testing questions that came up in the chat. And so let me just go to them really quick. Again, a question about we do not have a health professional in our central office. Is it permissible for a trained, responsible adult to do the test?
So the insert for Binax and their emergency use authorization all state that these tests must be administered by a healthcare professional.
Thanks, Karen. And you know, one of the things that we've been really as a mantra is just to repeat information because we know that people are under a lot of stress right now. So Karen, the question is, how do people register for the training?
Information will be sent out through the school nurse listservs and will also be listed on the BU Shield, which is our school health unit training vendor website when registration is open. It is not yet open. I would expect that you will get this information early next week about how to register and what you need to have on hand in order to participate. And it will also be posted up on the BU Shield website.
Thanks, Karen. Thanks very much. And I'll see if there are other questions relating to testing as we go. Jackson, some questions for you. What if someone already has an account? I'm imagining this is a Project Beacon account from using the Revere site.
Yeah, great question. Makes a ton of sense to ask that. The folks asking that question and curious about the answer may be familiar with the fact that we already have support for multiple profiles for an account that you might use to test your children or your family members at the Revere site today. And that same principle is going to carry forth in this model, where you may have a public profile for getting tested at Revere, but then you would also have an organizational profile associated with your school. So from your drop-down list of profiles that you can use, my kid's name is Spencer, so I might have a Spencer profile that's public so that he can get tested at Revere. I might have a second one that's associated with Bowen's school, his elementary school. And so one set of credentials can help operate both of those situations. But great question.
Thanks, Jackson. Jackson, another question about Project Beacon software. Does it have any ability to interact with Snap software?
It doesn't today. Certainly interested in learning more about ways that we could be supportive there. At the moment, this is all very custom built and single purpose toward the COVID testing process, but anything that we can do to make things easier is something that we would definitely want to talk about more.
Great, thanks very much. And regarding registration, Jackson, the question is, do we all register for an account, or is one done for the entire district?
It's very important that each individual have their own credentials to operate under the system for security purposes, for privacy purposes, and so on. So the intention is that each individual, whether on staff or the participant or their parent or guardian would have their own credentials to use in this system.
And thanks, Jackson. And I can actually clarify on that a little bit. So each person who might get a test, or their parent, so a staff member or a parent guardian, they will have their own kind of testee account. So they definitely each need their own account. But one other important thing to know from the administrative side is that the Project Beacon system is kind of school focused. So there's not one account for the district, there's one account for each school. And so when we say, one or two people at each school, that's exactly what we mean. So there's, you don't need to find the one person at your district who's going to put in the results of all tests. But you should probably find one or two people at each school that's going to be putting in the results of the tests.
And if that ends up needing to be 3 people at a school, that's fine. We can associate 3 logins with the administrative privileges at a school as well.
Great. Lauren, a question about Cleo waivers. And this, the need to submit the prerequisite checklist to us, the readiness checklist. Do you need to have the actual physical Cleo certificate to submit the checklist? We have been approved in writing via email, and we were notified that it will be mailed out once the payment is made.
Yep. So we're asking schools to submit either the copy of the certificate or the certificate number that you receive in email.
So
and
once
I'll
you have that,
I'll just add a little bit of color, but in order to complete the setup process on our end, we need the CLIA ID number as well. So that's an important part of the process.
Great. And a question about supplies. Do we need to have the supplies on hand or just to have ordered them? Colleagues, feel free to chime in, but I would say as long as you've ordered them, we would encourage you to submit. The idea is that you would definitely want to have them on hand once you begin to administer the test, but if you've ordered them, that would make sense to me. Karen, Jill, any feedback on that?
I'm not really sure what the question is, but certainly to participate in the training, you do need to have test kits on hand.
But more like the PPE. If you don't have the PPE on hand yet, but you've ordered it, we would still say, yeah, move ahead because you've ordered it. But what are your thoughts?
Move ahead with
submitting the readiness checklist because you've ordered the PPE as opposed to waiting until you have the PPE on hand.
Well, I mean, certainly you can't administer any tests until you have the PPE. And also, if during the training, folks are going to have the option to either perform a test on another person or on themselves. If they're going to perform the test on another person, a colleague, for instance, they would need to have PPE on hand in order to do that.
Right. Thanks, Karen. Translations. Jackson, is the Project Beacon consent going to be translated in the web-based form, or do we need to have families who do not speak English take the paper-based route?
We are definitely working on having translations for the consent form, as well as the entire interface, user interface. Today, it's available in English and Spanish, but in the coming days and weeks, we'll make sure that it's available in other languages as well. I will also note that we've spent a lot of time making sure that our interface is reasonably affordable to screen readers and other accessibility devices. So we should be able to accommodate users with certain types of disabilities as well.
Thanks, Jackson. We've had a few questions that have come in about the standing order that needs to be signed by a physician. And so in this case, the question about if you can't find a prescribing physician to sign the standing order, we've had this question, and Karen and Jill, we've talked about this a bit, that there isn't an easy way around this. We do hope that local boards of health will be useful. And so my advice would be to go to your board of health and ask for assistance in their connection to a prescribing doctor who could sign the doctor's order. Karen, Jill, anything more you'd want to add there?
I believe in the guidance released by DESE, it does identify that it needs to be your school physician or a physician employed by your local board of health.
Great, thank you.
So Russell, really quickly, I've gotten a
please.
couple of questions privately in the chat, and they're the same questions, so I'll just amplify them a little bit. Folks are
Please.
asking what roster information is going to be needed to submit for students, and that's a short answer. We're able to, if an organization chose to, they could submit as much information as is available, but the minimum is a first name, a last name, a mobile number or email address so that we can contact them with the invitation, and then the choice of which consent form will be applicable to that user. So those 4 fields are the minimum for us to get moving with a user.
Great.
We'll obviously have more information about that in forthcoming webinars, but just high level, that's the.
Thanks, Jackson. And Jackson, when will people find out more about those upcoming webinars? Can you just repeat that?
You will learn about those upcoming webinars shortly. I don't have a perfect answer to that. So I'm not sure if we've set exactly those dates, but we're working on it, and they should be in the coming days and weeks, and we'll have multiple of them. So no worries if you can't make the first available date. We'll definitely have that information and recordings of them and slides available.
Great, thanks, Jackson. Lauren, some questions about once people submit their readiness checklists, how will they know that test kits are coming to them? What would they expect in the way of communication back to them?
Yep, great question. So once you submit your readiness checklist, we will then send you a confirmation email that says that you have submitted all the correct information after we verify it. And we will then send you a resource request form then you can, with the email address where you can send it to DPH to actually order your tests. So that will come in email to you and through a link with all the information about placing the order for your tests.
Great, thanks, Lauren. I'm going to take the last question. I see the person whose hand is up, and I see your question, so I'll answer it right. I'll ask it right now, and it's really about the safety of this procedure. Karen and Jill, if you would mind helping out with this, if tests are being done outside due to the aerosolization of the procedure, how can this be done safely within the school building? Now, if tests are done at health centers, afterwards, testing rooms are closed to 1 to 2 hours, depending on the airflow in the room. How can BinaxNOW be safely done inside a school building? Any thoughts on that? And we can also follow up if we need to on a question like that.
I think that's a great question to follow up with. I do know that in the guidance so far, we've identified the need to be wearing proper PPE. And I know that I've been talking a bit with the infectious disease folks about how to implement this safely in the school environment in the context of medical waiting rooms and so on. So I think we're going to have to follow up with some more information about that.
Great, thanks, Karen.
I would add to Russell,
please, Jill.
Dr. Smalley might be able to be a better one to answer that if she's still on. But I would also add that if people are thinking about conducting tests outside, these tests do have some pretty specific temperature ranges as far as the temperature at which the test can be conducted. So certainly as the weather gets colder, that may be more challenging.
Thanks, Jill. Appreciate that extra piece of advice there. So we are at time, and I really appreciate everyone being with us today. We will follow up with information about forthcoming webinars. I'll also make sure that we follow up on, there were many, many questions in the chat, and I very much appreciate them, and I'll make sure that I share them with our team so that we can continue to provide resources to you that will support you with your administration of these tests and being part of this initiative. So I wish you all a very nice weekend. Thanks for being here with us today, and thanks for your interest in BinaxNOW. Take good care.